Hello everyone, and I hope you're well and you're having a really good week. In today's video, I am going to tell you what the signs are to look for during a booking, which will tell you if the child that you're looking after is healthy, if they're ill, or they're in need of emergency care. Now, whilst working as a babysitter, you might find yourself in a situation where you're thinking, is the child ill or are they okay? Now, whilst babysitters are not expected to be medical professionals, it does help if you know what signs to look for if you suspect that the child that you are looking after might be ill. Just use your common sense and your first aid knowledge, but also know when your knowledge of first aid ends and you need to contact emergency services to take over if the child deteriorates under your care. Now, there are three important things to remember when you think something might not be right with the child you're looking after. Firstly, just trust your instincts. Secondly, keep really calm in a medical situation. And thirdly, know when it is time to look for medical help. So the first thing we're going to look at is how to spot a healthy child. So a healthy child will always have a glowing complexion, they'll have shiny hair, they'll have a dry nose, and they'll be laughing and smiling a lot. They'll be bouncing with loads and loads of energy and have a really good appetite. They'll sleep soundly as well. So this is generally what a healthy child looks like. Any deviation from these means that there is likely maybe something else going on with the child you're looking after. Be it maybe a physical problem, a mental problem, or even a social problem, which you should just observe a little bit closely and more carefully, and definitely let the parents know if you suspect something might be up with their child. Now let's look at how to spot an ill child. So babies can become very sick very quickly, and as they can't speak, they are totally reliant on you to spot any signs of illness. Toddlers might be a ball of fun 1 minute, but then be crying on the bundle on the floor in the next. So early signs to look for include things such as the child is extra tired despite having a really good night's sleep. Secondly, the child is not wanting to play or participate in anything. Thirdly, the child is quieter than normal. Fourthly, the child doesn't want any food. And the child also doesn't want to drink anything. The child might also have a temperature. So checking a child's temperature is probably one of the most reliable ways of determining if a child is ill. Now, most parents will have a thermometer in their house, which hopefully you will be able to find. Now, a digital thermometer is the most accurate thermometer on the market, but they're also the most expensive. So be aware that parents might not have one. And as a babysitter, you're not expected to have one yourself. Make sure you know that normal body temperature is between 36.5 degrees and 37.2 degrees before you take a child's temperature. Anything over 38 degrees means that the child has got a fever. Now, if you cannot find a thermometer in the parent's house, then you can tell if a child has a fever by doing this, although it's not entirely accurate. So by touching the forehead with the back of your hand, and if it is hot, they're likely to have a fever. You can also look to see if the child's cheeks are super rosy. If they're red flushed cheeks and they haven't been doing exercise, then it's a sign of a fever. Thirdly, you can look for other symptoms like shaking or feeling extremely cold despite having a really hot forehead. Now, how to spot when a child needs emergency care. So the signs to look for include things such as if the child is convulsing, the limbs are twitching or jerking. If the child has got a temperature over 39 degrees, they've got clammy hands and clammy feet. Also, if the child has spots or purplish rash on their body that does not change color or disappear when it is pressed with the side of a glass. If the child is very pale, blue or floppy, this might also be an indicator. And if the child is struggling to breathe or breathing is really, really shallow, this is a problem. If the child is confused or is extremely drowsy or is difficult to wake up, then this is also a problem. If you spot any of these signs, then you must call emergency services on 999 and then call the parents to update them on what is happening to their child. Make sure you also know how to perform baby and child CPR. You just never know when you might need it. The British Babysitting Association has recorded a few videos on how to give CPR to both a child and a baby, which you can familiarize yourself with by subscribing to our British Babysitting YouTube channel. Also, if you have got any questions relating to anything in this YouTube video that you might want more information on, then just do send us an email at hello@britishbabysitting.com. We'd love to hear from you. Thank you so much for watching this video, and I hope you have a great week. Bye-bye.